Hello everyone, a very warm welcome from the SGT University. I am Dr. Shikhar Ganjoo, Associate Professor, Department of Dermatology, Faculty of Medical and Health Sciences, and today we'll be learning about acne vulgaris. Acne is perhaps the most common dermatosis affecting the adolescent population and may cause a significant psychosocial impact due to its visible nature and its potential for scarring. Acne, by definition, is a chronic inflammatory skin condition. It usually affects the adolescents during puberty. To understand the clinical features of acne, it is very important that we delve into the etiopathogenesis of acne. Causes of acne include various factors. The primary cause is the activation of sebaceous glands during puberty due to testosterone and androgens in both adolescent males and females. Sebaceous glands are found in the skin connected with the hair follicles, which secrete an oily substance called sebum. The sebum is brought to the surface of the skin by a common opening of the pilosebaceous unit along the hair shaft, and it is required for protection and lubrication of the skin. Acne occurs when excess of sebum is produced. Sebum alongside dead skin cells accumulates, resulting in clogging of the pilosebaceous unit. This then stimulates the bacterial proliferation. The resident flora that is normally non-pathogenic can cause inflammation, leading to inflamed papules, pustules and cysts. A summary of the etiopathogenesis. To understand the clinical features, we need to explore the etiopathogenesis in detail. The first step, as we have seen, is an androgen-induced seborrhea. Thereafter, there is comedone formation, the blackheads and the whiteheads. This stage is also known as comedogenesis. Colonization of the pilosebaceous duct with propionibacterium acne happens thereafter. And subsequently, there is production of inflammation. As we can see on the left hand side slide, there's an early comedone, or a microcomedone as we call it, which happens due to the increased keratin production and excess sebum secretion. On the right side is a later comedone, which can be divided into a closed comedone, which is covered by skin, and an open comedone, in which the pilosebaceous material is not covered by skin and communicates directly with the skin surface. The third stage is the papule or the pustule formation, in which the bacteria proliferates and initiates an immune response which is marked by mild inflammation. Subsequently, the last stage of acne is also known as the nodular or the cystic stage, which is marked by excessive inflammatory response that leads to the rupture of the wall and eventually scarring. Coming to the clinical features of acne. Acne is characterized by polymorphic lesions. What that means is, in a single patient, they may all have the comedones, the papules, the pustules and the scarring. As we have seen, the open comedone or the blackhead is a dilated pore which is filled with the black keratin material but is not covered by skin. The closed comedone or the whitehead is a small colored dome-shaped papule which is covered by. The comedone is the most characteristic lesion of acne. On the left side, we can see the black head or the open comedone. On the right side, we can see the closed comedone or the whitehead. The later stages involve formation of inflammatory lesions, as we can see the picture on the left, or there can be eventual scarring which looks like this. The following is the diagrammatic depiction of scarring. Moving ahead to the diagrammatic depiction of scarring. The scars in acne can be divided into three types. We can have rolled up scar, we can have an ice pick scar, and we can have a box scar. As we can see, the ice pick scar, which is the least in the width, is the deepest in depth. The box scar is quite wide and quite deep, whereas the rolled up scar is very superficial, going just to the level of upper dermis, whereas it is quite broad in its width. Now coming to history taking in a patient with acne. When a patient with acne presents to us, it is very important that we ascertain the duration and the frequency of acne. Whether the acne waxes and wanes with the menses, whether it is acute onset, whether it is chronic onset. It is also important to understand what patient's prescriptions are, whether the patient has been taking over-the-counter treatments, any prescription products, any creams, sunscreens, makeup that the patient has been applying. It is also important to look for certain drugs that may trigger acne in an individual patient. In females with acne, it is important to ascertain the correct menstrual history, a history of hormones intake, and also a history of polycystic ovarian disease. The dietary factors includes foods with high glycemic index and drip supplements that can cause acne. Certain other triggers which are very important in a patient with acne include stress, seasonal variation, food intake, and topical products. Now coming to the treatment of acne. The acne treatment can be summarized into the drugs which act on various stages of the acne pathogenesis. So the drugs that act on the obstruction of pilosebaceous duct, these are the drugs that normalize the follicular keratinization. These include adapalene, tretinoin, and isotretinoin. Broadly, these are known as the retinoids. Drugs that act on the proliferation of propionibacterium acne are also known as antibiotic drugs, and drugs that have antibacterial effects. These include the antibiotics and benzoyl peroxide, which acts by a free radical mechanism. The third set of drugs are the anti-inflammatory drugs that include antibiotics, corticosteroids, and NSAIDs. The fourth set of drugs are the drugs that help to decrease the sebum production, which includes the retinoids such as isotretinoin, anti-androgens, and estrogen. Now coming to a very important molecule, isotretinoin. It is also known as 13-cis-retinoic acid. Isotretinoin has revolutionized the treatment of acne vulgaris. This drug binds to the two nuclear receptors, that is the retinoic acid receptor and the retinoid X receptor. Subsequently, this results in expression of a number of proteins involved in growth and regulation. The common side effects of isotretinoin include cheilitis or the drying of lips. Other side effects includes headache, dizziness, joint pains, muscle pains, and raised liver enzymes. The most threatening effect of isotretinoin includes its ability to cause teratogenicity in an unborn child. Thus, it is a category X drug, and if taken during pregnancy, it may cause cranial, facial, thymic abnormalities, and CNS malformations have also been reported. Now lastly, coming to the antibiotics. The antibiotics are used against propionibacterium acne, which is a major trigger for acne. The systemic antibiotics include doxycycline in a dose of 50 to 100 milligrams, minocycline in a dose of 50 to 100 milligrams, and azithromycin. The topical antibiotics include clindamycin and erythromycin. Today we covered acne vulgaris. The next time we'll explore psoriasis vulgaris. Keep learning, keep growing. See you next time.